is my audience. Hi class, my name is Kaylee again. Today I will be demonstrating and discussing the proper hand washing technique, for those of you who may not know how many steps are actually involved. Each year, over 1 million Americans alone die from illnesses and diseases that could have been prevented by the proper hand washing, such as the common flu and cold. Think about the number of times that you shake somebody's hand throughout the day. How do you know they didn't just come from the bathroom without sanitizing? How do you know that their hands are clean? Every 4 out of 5 people are said to be skipping hand washing, especially in public places, even when soap, water, and paper towels are provided for them. When we were all very young children, we were taught how to wash our hands and the importance of it. What we didn't learn was just how many steps actually go into what is considered the proper hand washing, according to the CDC, or Centers for Disease Control and Prevention, and also what I had learned my junior year in my CNA class. It's scary to me to think about how many people are not well informed on how to wash their hands properly, and could be potentially harming themselves or anyone around them simply because they are not aware. In 2013, the CDC estimated that the proper hand washing skills, if you are using the proper hand washing skills, you can reduce the risk of respiratory illnesses such as the flu and cold by 16% just by washing your hands alone. Studies also show that 95% of people do not wash their hands correctly, leaving just 5% that do. Now I will go into further detail to describe the difference between good and bad water sources, as well as when hand washing is most recommended, and of course by teaching you the proper steps to hand washing. When most of us think of water, we think of the good kinds that help us to kill off the germs instead of by breeding them. Some waters can be more harmful to you, as we know, such as river or lake water, because some people use these water sources as a dump, including for trash, bottles and cans, and in some cases even urine and feces. Another source of water that is not considered the safest are public pools and water parks. Although the water is filled with chlorine, it doesn't always help to kill all the germs. Hand, foot, and mouth disease has been common lately in young children under the age of 5. This can be contracted by contact with an infectious person and by the improper hand hygiene. You are encouraged to wash your hands after using the restroom, as we all were taught. Another big concern is if hand washing is being done at all, and correctly at that, after changing a dirty diaper. Washing your hands before, during, and after food preparation helps to stop the spread of infection and as well as to prevent cross-contamination. And of course, whenever your hands look or feel dirty, and for healthcare workers especially after contact with a sick patient. The proper steps go like this. The first and most obvious thing you should do is to turn on the faucet. You should allow the water to reach a lukewarm temperature and make sure that it's comfortable and not too hot. If you're wearing long sleeves, it's important to roll them up so they are not getting wet or in the way. Once the water has reached your goal temperature, it is important to wet your hands completely before you apply soap. Once your hands have soap and water, apply friction and work up a good lather. In the healthcare field, we are taught to keep our hands lower than our elbows at all times. As you are scrubbing your hands together, be sure to get in between all the cracks, in between your fingers, and of course underneath your nails, because that's where the germs can be stored. Clean the tops of your hands as well as your palms and 2 inches above your wrist to ensure that you're getting the job done. You then of course proceed to rinse thoroughly but be sure that your hands do not touch the sink or the faucet. Otherwise, you're just recontaminating yourself and you'd have to restart the process all over. It's also very important not to shake your hands, because that is said to stir up dust particles in the air and put germs right back on your hands. And then grab a paper towel. All you need is one. Dry. And also use that paper towel to turn off the faucet. And if you're leaving a public bathroom, to open the door handle, because the door handle harvests a lot of germs. Once you're finished, you can then throw your towel away and you can continue. In conclusion, by knowing the proper hand washing technique, you would be protecting yourself and others around you. Knowing the difference between good and bad waters, as well as knowing when hand washing is needed, is just as important as knowing the proper steps to a healthier you. Yeah.